Good morning, everyone. Thank you for being here. Today, I'm presenting a 2018 study titled The Effect of Vitamin D on Muscle Function and Injury in Elite Adolescent Dancers. This was a randomized, double-blind trial that explored whether supplementation could offer meaningful benefits to this specific athletic population. To set the stage, please listen to the previous studies on vitamin D in dancers. In summary, we know from prior work that vitamin D insufficiency is incredibly common in dancers because they train indoors and they miss out on the primary source of vitamin, which is sunlight. Some studies show insufficiency rates as high as 80%. Second, vitamin D isn't just bone health, it plays a crucial role in muscle function. For adolescents going through their growth spurt, optimal levels are vital for proper musculoskeletal development. Low levels have been linked to decreased strength and power and a higher risk of injury. While we had data on adult athletes, there was a gap in knowledge regarding adolescents. So the primary aim of this study was to see if a 4-month vitamin D supplementation program could actually improve muscle function, more importantly, reduce injury rates in this young high-risk group. The study employed a rigorous randomized, double-blind, placebo-controlled design. Participants were 67 elite adolescent dancers aged 17 to 19 from a single vocational school. They weren't casual dancers, they were training 33 to 36 hours a week. The intervention took place over 4 months, from January to April, at a latitude of 51.5 degrees north, a time and place where sun exposure is minimum. The intervention group, which was larger due to a 2-to-1 randomization ratio, received a single bolus of 120,000 international units of vitamin D3. The placebo group received identical inert tablets. This bolus approach is worth noting. It was chosen to bypass the compliance issues that can plague daily supplementation regimes, and a previous study has shown the benefit of this method. So what did we measure? Data were collected pre and post intervention from both groups. First, we had the primary biological marker, serum 25-hydroxyvitamin D levels, taken from the venous blood samples. Second, we assessed muscle function using 2 types of test. Strength was measured via an isometric mid-thigh pull using a strain gauge. Power was assessed with a series of jumps using an OptiJump system to measure things like jump height and reactor strength index. Finally, and perhaps most crucially for this audience, injury surveillance was conducted by the school's in-house physiotherapists over the 4 months. They used a standard time loss definition and importantly distinguished between traumatic injuries, like a sprain from landing from a jump, and overuse injuries, like a stress fracture from repetitive load. Let's turn to the results. Starting with the vitamin D status, the pre-intervention group data confirmed the problem. Looking at the entire cohort at the start, a staggering 87% were either insufficient or deficient. Only 13% had what was considered sufficient levels. After 4 months, the picture changed significantly for the intervention group. The number of insufficient participants dropped to 53%, and 47% achieved sufficiency. Looking at the actual serum levels, the intervention group saw a substantial and statistically significant 57% increase in their vitamin D levels. The placebo group, as expected, saw only a minimal 18% increase, likely due to seasonal variation. The statistical analysis confirmed significant interaction between time and treatment group, meaning the change was due to supplementation. Now for the key performance and clinical outcomes. First, muscle strength. The intervention group showed a small but statistically significant 8% increase in isometric strength, as measured by the mid-thigh pull. The placebo group's strength slightly declined. We want to highlight a caveat here. We consider this 8% increase too small to be considered biologically relevant in a practical sense. It's a statistical finding, but its direct impact on performance is debatable. Second, muscle power. Despite the strength finding, there's no significant changes in any of the power tests between the two groups. The most compelling finding comes from the injury data. The intervention group experienced a significantly lower rate of traumatic injuries. Only about 11% of the dancers took vitamin D sustained as traumatic injury, compared to nearly 32% in the placebo group. This difference was statistically significant. Interestingly, there was no difference in overuse injuries, suggesting the effect might be specific to protecting against acute high-force events. So how do we interpret these findings? First, the study successfully replicated the findings of widespread vitamin D insufficiency in this population, reinforcing the need for attention to this issue. The dissociation between strength and power improvements is intriguing. We suggest that vitamin D may have a more pronounced effect on the type 1 or slow twitch muscle fibers involved in isometric strength, rather than the type 2 fast twitch fibers responsible for explosive power like jumping. We also note that dancers' typical training, which focuses on technique and Pilates, rarely conditions these type 2 fibers. This could explain why the power benefits seen in some studies on other athletes weren't replicated here. Finally, the reduction in traumatic injuries is a major clinical finding. We propose a plausible mechanism. A small gain in muscle strength, even if not enough to boost jump height, might be sufficient to provide better joint stability and shock absorption during high-risk activities like landing from a jump, thereby acting as a protective mechanism. To conclude, the study demonstrated that a single high-dose bolus of vitamin D3 was effective at improving serum levels in adolescent elite dancers. This improvement was associated with a modest increase in isometric strength, and most importantly, a clinically meaningful reduction in traumatic injuries. So what are the practical takeaways? For coaches, physios, and sports medicine professionals working with similar populations, the take-home message is threefold. 1, monitor. Don't assume your athletes have sufficient levels, particularly during and after winter. Testing serum 25-OHD is a straightforward process. 2, supplementation. The data suggests that monitoring alone isn't enough. Active supplementation is likely necessary to correct and maintain optimal levels in this environment. And 3, consider it an injury prevention tool. Optimizing vitamin D status appears to be a simple, low-cost and low-risk intervention that could play a meaningful role in reducing traumatic injuries. Of course, the study has limitations. It was conducted at a single school, and the intervention period was relatively short. The fact that over a third of the intervention group was still insufficient post-study suggests a single bolus may not be enough, and a repeated or maintenance dose is likely needed. Thank you for listening. Please see the link to the full article. This is the last in the series on vitamin D and dance.